You have been diagnosed with peripheral arterial disease, and you're wondering what's next. Hello, everyone. I'm Dr. Lorenzo Patrone. I'm a vascular interventional radiologist in London, in the UK. And with this week, I'm here with the Medical NotePAD, brought to you by Cardiovascular Systems Incorporated patient advocacy campaign called Take a Stand Against Amputation and the Way to My Heart. People who are diagnosed with peripheral arterial disease, which is a restricted blood flow in mainly the leg arteries due to plaque buildup, are categorized into different types: the claudicants and the critical limb ischemia. So it is important for you to know which categories applies to you because it dictates frontline treatment. So the claudicants are the people who can't walk very far before getting pain in their calves. They can get cramps, and the walking distance for them could be 50 meters, 100 meters, 1 kilometer. Instead, critical limb ischemia are the patients who are most affected by peripheral arterial disease and are the patients who, for example, can't sleep in the bed because of the cramps coming into the night, or instead, even worse, can have tissue loss, so little ulcers at the level of the foot. Why is it important to know where you fit in the diagnosis? Because most patients will never move beyond the claudicant stage. And this is a disease that you can treat yourself. You can push yourself through a pain. You can start by walking more and more, changing your lifestyle, stopping smoking, and getting a better diet to develop collaterals. Means like if there's a blockage, you create little narrow streets around the main road in order to get the blood down to the leg as before. The more you push, the more you do exercise, the more you change your lifestyle, the more you will build up collaterals, and the better will be for you. And the symptoms slowly will go down. Of course, for critical limb ischemia instead is a disease which is rapidly progressive, and it's important if you develop pain during the night, or even worse, you have tissue loss, you contact as soon as possible your vascular doctor in order to get, of course, diagnosed with the right tools and treated. Remember that the advice and views offered are for educational purpose only. We have a very little chat, but always check with your own healthcare team for explicit content to act or any information offered there. If you want more info about peripheral arterial disease, go to standagainsamputation.com, and for real-time support, go to thewaytomyheart.org.